Hi, you are welcome to Achievers Bridge YouTube channel. In this video, I am going to be teaching you how to treat and prevent ulcer. If you are watching me for the first time, here we talk about finance, which ranges from business acquisition, forex and crypto trading. We talk about health, relationship, skills and knowledge, as this is what it takes for a person to be truly successful. Our belief at Achievers Bridge is that if you have all the things mentioned but you lack one, for instance, you have everything but you lack good health, it means your success is not complete. Or if you have everything and you lack finance, it means your success is not complete. So in this video today, we are going to be focusing on the health aspect of it, which is ulcer to be specific. As such, if this is your first time on this YouTube channel, kindly click on the subscribe button below and turn on the notification bell so that anytime an important video like this is uploaded on this YouTube channel, you will be notified. So back on the business of the day, which is ulcer, how to treat and prevent ulcer. So we are going to be looking at ulcer in three important outlines. The first thing is, what is ulcer? First of all, we need to know what ulcer is before we will talk of how it is caused and how it can be prevented or treated. And then the second outline we are going to be looking at is what causes ulcer, what are the causes of this ulcer. And then the third outline, which is the last outline we're going to be looking at, is how to treat and prevent ulcer. So I'm going to be using a layman language so that anybody out there will be able to know what I'm talking about and then benefit from this knowledge. So what are ulcer? What is ulcer? When we say ulcer in a layman term, simply means an open wound. Okay, so and in this video today we are going to be focusing on peptic ulcer disease or gastric ulcer diseases. Okay, so majorly we do have people that complain of heartburn, you know, everywhere, every here and there. Everybody you see in the society, you just hear people say, oh, I have ulcer. This one will say, my heart is burning, my stomach is paining me. So we are going to be addressing this issue once and for all, and then see how we can be able to support people the important knowledge for them to be able to prevent and treat ulcer. So ulcer simply means, as I've said, an open wound, and in this case an open wound in the inner lining of either your stomach, your intestine, your duodenum. So if you have an open wound or a sore appearance on the inner lining of your stomach or your intestine, it means you have an ulcer. So if you have been suffering from ulcer before, then know that that is what ulcer means. There are other forms of ulcer, for instance, a diabetic foot ulcer that majorly causes as a complication in diabetes and things like that. So that is not our content of the day. So we are going to be focusing more on peptic ulcer disease or gastric ulcer diseases. Okay, so now what are the causes of these open wounds in the inner lining of our stomach or the intestine? We are going to be looking at four important things that majorly causes this ulcer. Okay, the first thing we are going to be looking at is starvation. The first thing that we are going to be looking at that causes ulcer is starvation. You know, most people are fond of staying, you know, starve themselves and they stay for a very long hours of the day without eating anything. And before you know it, if they consistently keep on doing that for a longer period of time, then before you know it, they are down with ulcer. Then how does starvation causes ulcer? I know this is a question that someone may be asking. Our stomach is wired in such a way that it normally secretes an acid called the hydrochloric acid, which helps in digesting whatever we eat into our stomach. But in this case, if someone does not eat anything for a very long hours of the day, then when this hydrochloric acid is secreted in the stomach, instead of it to act on the food, it will now be what? Acting on the inner lining of the stomach, and before you know it, it begins to cause abrasion on the surface of the inner lining of our gastrointestinal tract. And before you know it, it begins to what? To form a wound and a sore-like appearance, and before you know it, it becomes a pain. Now, just imagine it. They used to say that people normally know that even people that have not gone to science classes or people that have not gone to medical schools, they know that when an acid pour on the surface of your skin, it can burn the surface of your skin. Okay, so that is something that happens in the inner lining of your stomach. When the acid goes directly to the surface of your stomach, instead of them to act on the food, then they are going to cause some burning sensation, and before you know it, causes inflammation and then ulcer. Okay, so that is how starvation causes ulcer. And then the second major point we are going to be looking at is abuse of drugs. Which drugs can this be? One may be asking, okay, abuse of drugs, which kind of drugs causes ulcer again? There are classes of drugs we call NSAID, and this NSAID ranges from drugs like paroxycam, which normally ladies use to take when they have menstrual pain, you know, drugs like ibuprofen, drugs like diclofenac, and all these classes of NSAIDs. People do abuse these drugs on daily basis. You will see somebody having, okay, I have a back pain, let me go and buy Feldin. Someone will say, oh, let me go and buy paroxycam. Another person will say, okay, I have a very long day today, so I've trekked from this place to this place, so I think I need to take pain relief. They will just end up going to buy Feldine, going to buy Pyroxicam, as the generic name is, ibuprofen, diclofenac, mefenamic acid, and things like that. So majorly people do abuse these drugs on daily basis. Now, how do these drugs causes ulcer? Okay, now let me take you through that. Okay, I'm going to be as shallow as possible so that I will not take you deep into medical terms and terminologies, so that you will not be lost. So the aim of this video is to be able to educate the public on how to prevent ulcer. Okay, so how these drugs causes ulcer is that our inner lining of our gastrointestinal tract consists of what we call the prostaglandin. So please don't bother to know what prostaglandin is. Just know that there's something that lines the inner surface of your gastrointestinal tract called prostaglandins, and this prostaglandin protects the inner lining of the stomach. What these drugs does is that they inhibit prostaglandins. So now, instead of these drugs to go and only act on where the pain is, then they will also go to the inner lining of the stomach and also begin to inhibit these prostaglandins, and before you know it, it will begin to deplete, or it will begin to wear away the prostaglandin lining of the inner part of the gastrointestinal tract, and before you know it, small abrasion on the inner lining of the stomach, it causes inflammation, and it causes what? Wounds. And before you know it, wow, small thing, okay, my stomach is paining me, oh, I have heartburn. Okay, so please try to prevent taking drugs without a prescription from your doctor. Okay, if you are not being referred to take that drug by a medical personnel, then please avoid taking these drugs. And then the third major cause that we're going to be looking at, that causes ulcer, is taking of peppery substances, sour substances. There are food substances that when people take, it causes wounds in the inner lining of the stomach. Okay, now forget about the stomach for a second. Now let's look at it in this case. When you carry pepper with your hand, when you wash pepper, when you cut pepper with your bare hands, how do you feel it? In some cases, me in a person, I avoid cutting pepper with my bare hands because if it touches my hand, for the whole day I'm going to be suffering from the pain that is going to come from that pepper. Then now shift that to the inner lining of your stomach. Imagine those pepper having contact with the inner lining of your stomach. Then it's going to cause what? Inflammation. And once it causes inflammation, it's going to cause pain, and before you know it, it causes wounds and abrasion, and before you know it, you are done with ulcer. Especially if you do take these substances in a very large quantity for a very long period of time. Before you know it, you are done with ulcer. Things like fried food, excessive fried foods, taking of things like that, and then taking of what? Gaseous substances. We all know most of these gaseous substances are acidic in nature. Just the way this hydrochloric acid does, that is how when you take it for a very long period of time, it's going to expose you to what? Ulcer. And then lastly, one other major cause of ulcer that we're going to be looking at is infection. Majorly, one of the bacteria that is involved in this is H. pylori, that is Helicobacter pylori. This bacteria is, if found in the stomach, causes a lot of abrasion and internal sore or internal wounds in the inner lining of the gastrointestinal tract. That is why when you go for ulcer test, in the lab, they majorly test for this very bacteria though. So if you have H. pylori in your inner lining of your stomach, then you are likely to come down with ulcer. Those are the major things that causes ulcer. There are other minor things that can lead someone to come down with ulcer, but in major cases, those are the things that makes people to come down with ulcer. The last point we're going to be looking at is how to treat and how to prevent this ulcer. If you don't have ulcer, okay, then the next thing you're supposed to take is start preventing ulcer by paying attention to these things that causes ulcer mentioned earlier. Try to reduce the intake of substances that causes ulcer, things like pepperish food, things like sour substances, gaseous substances. You look at these drugs that majorly causes ulcer. Please, if you are fond of taking these kind of drugs like Pyroxicam, ibuprofen, diclofenac, and sort of drugs like that, please don't take them unless you are being prescribed by a doctor. Generally, for any drug that you take, please try to avoid taking drugs. Not only this drug that causes ulcer, any drug that is not prescribed to you by a doctor, please avoid taking it. Okay, and also you should try to avoid starving yourself for a prolonged period of time. Another way you can be able to prevent coming down with ulcer is washing your food and cooking your food properly. For food that don't need to be cooked, like vegetable salad, things like that, you should try to wash them properly before eating them. You may not know, they may likely be infected with H. pylori, but if you wash them properly with salt before eating them, then you have a high chances of preventing yourself from being infected with H. pylori. Okay, and for foods that need to be cooked, for instance, you need to cook it properly so that in case it's infected with H. pylori, then you are going to be able to get rid of it with proper cooking of those foods. And for people that are down with ulcer, please pay attention to these important points I'm going to be passing. It's not all about taking drugs. It's not all about taking drugs. It's not all about, omeprazole. It's not all about MMT. But it's about you, first of all, trying to reduce all the causing factors, reduce all the things that causes ulcer, prevent all the things that are likely to cause you to come down with ulcer. For instance, you avoid taking too much of pepperish food. You avoid too much taking of sour substances. Then you avoid taking of drugs that are not prescribed to you by your doctor, especially the NSAID as I've listed. You avoid starving yourself. That is when you now begin to talk of treating ulcer with drugs. Because if you keep on treating it, coming down with it, treating it, coming down with it as a result of you not avoiding the causes of ulcer, then chances are that you're going to come down with a complicated ulcer that drugs will not be able to treat it. You will always be in a pain such that only surgery can be able to treat that kind of ulcer, and of which I would not be happy if anybody goes to that stage of ulcer. So please, if you go to the hospital and they give you drugs that you're going to be taking, and then they advise you on the kind of food that you're going to avoid taking or reduce taking them, please pay attention to them. Even if you are relieved from the pain, even if you finish taking your drugs and you are now relieved from it, try to pay attention to these causes. Avoid taking sour food, avoid starving yourself, avoid taking uncooked food, or will I say improperly cooked food, avoid taking food that are not properly washed, avoid just taking food from anywhere and just eating, so that you will not be able to reinfect yourself with H. pylori or expose yourself to things that will make you to come down with ulcer again. I personally do experience heartburn, do experience ulcerative kind of pain, but it's because I understand the causes and because I understand how this ulcer operates and how to prevent them. I can stay for a full 1 year without experiencing an ulcer pain. That is it, and I will not be taking any drug. So that is how you can be able to prevent ulcer. But believe you me, if you keep on taking all those food substances that causes ulcer, if you continue starving yourself, you continue taking NSAID, abusing them, you continue taking gaseous substances anyhow, even if you treat ulcer, even if you take drugs, you will continuously be coming down with ulcer. So please and please pay attention to this thing. I believe if you will be able to pay attention to these things, then you may likely to stay for a very long period of time without experiencing any ulcerative pain, without even you taking any drug. Okay, so for further information, if you want to know more about ulcer, you can go and meet your doctor or you meet your pharmacist. Then you go and get to know more about it. I believe if you pay attention to this, you will be able to stay healthy without coming down with ulcer. So thank you very much. Thank you very much. Once again, if this is your first time on this YouTube channel, kindly click on the subscribe button below and turn on the notification bell so that when an important video comes up like this, you will be notified.